Hi everyone, it's Ella again, and I am here to discuss my 1-year post-op with CG Cosmetics. If some of you watched my previous video, I had a mommy makeover, which includes a breast augmentation and a tummy tuck. So definitely stay tuned. I have a lot of questions and answers for you guys. First, I want to say thank you to all the ladies that reached out to me. I hope I answered your questions the best way I can. Some of you commented on my YouTube page. Some of you went in and responded, questioned me on my Instagram account, and I did my very best to respond to you guys. If I did not respond, I do apologize. I am a single mother of 3. I own a business, and I've been going through some mix-ups and hiccups and, narcissistic relationships. Oh my God. But that's a different day. But if y'all want to hear that story, I got the tea. Just ask. But anyway, yeah, so I just jot down some of the questions that I've been getting on my Instagram account and some of the comments that I've been seeing. So I want to go ahead and dive right into it. So the main question is, how was your experience with CG Cosmetics? Once again, I've said it before, my experience was great. I did see reviews where other people weren't so happy, but my experience was great. I am grateful for CG Cosmetics. Until this day, they still check up on me. I get messages from CG and stuff like that. So to me, it means a lot. And I do believe in leaving reviews for people that does good. So this is my review. This is how I feel. I have to say, Dr. Loessin is an amazing doctor. I've been in the medical practice for quite some years, and not very often you find doctors that actually want to talk to their patients. So he was down to earth. I definitely encourage others to book him, but always do your research first. Like I said before, different doctors, they might be used to one particular body and do a certain work on that body. So I say, when you're doing your research, you're looking at their before and after pictures. You're looking at what body they work best on, what body type they don't work so good on, or whatever. So that's just my advice. But anyway, so my experience was great. The second question I got was, how many cc's do I have? I have a 470. I did get questions about, did I choose it or did the doctor choose it? To be honest, I showed him a picture of what I wanted, but then again, I told him, please, make sure it fits my body. I don't know the sizes. I didn't even get a chance to see what they look like or what they feel like. I just, told him to pick that out for me, and I trust him. He works with bodies. He should know what looks great. And I am very thankful he picked a 470 cc's. So, and they are the gummy bears, so they're the silicone ones. I don't do saline. I've seen too many reviews of saline and how it looks fake and stuff like that. Now, how does my breast feel? I have to say they feel very natural. I love the way they feel. I love the way they look. At the end of this video, I'm definitely gonna have some pictures. I'll see if I can find my before pictures, and then I'll have my after pictures, but you can definitely check out my Instagram account at _Ella Sky, and you'll be able to see like pictures I had before my surgery and pictures that I have now. But I definitely like them. They feel real. I would say, like, the feelings is there. I have feeling and stuff. Everything seems fine. Here and there, like if I lay down on the side, it kind of feels funny. But then again, I do have to let you guys know, when I was 17, I had like a non-tumorous lump on my breast that had to get removed. So that scar is starting to feel a little weird, which is the side. Not the scar that I got for having the implants, but the scar that I had from when I was 17 and had surgery. So that scar is starting to feel weird. I don't know why. I will eventually get that checked. This just happened like last week. So the other question I have been getting is, did I have any swelling when I had my tummy tuck? Yes, I had what was called seroma, which also brought fluid into my stomach. And I had to drive back to Miami, get the fluid drained at least 2 or 3 times. The third time I went there, they told me they were going to leave it alone, and whatever. Just I continued with my massages. And after that, that was it. Here and there, I would have swelling, and usually it's most of the time when I eat salt. I would blow up like a blow up fish. So if I reduce my salt intake, or if I don't eat for the day, my stomach is flat, it looks really nice, whatever. So I did experience some swelling at the beginning, and then it started to look good. And now it's been a year, and to be honest, guys, I still have swelling. I still have to be careful with my salt intake. What are the other things? Oh, and then I have like this, like, the very top of my stomach feels really, really hard, and sometimes it swells really bad. And when it swells really bad, I have to wear like a waist trainer to keep it down and like keep my back from not hurting so bad. And I went back to a massage therapist and just asked them like, hey, you know, I developed like this little hard lump right here. I'm not sure what it is. Sometimes it hurts. And they told me I developed seroma. So if you don't, did I just say seroma? No. I developed fibrosis. If you don't know what fibrosis is, it's like these little like hard knots that you can get in your stomach, but I don't have those hard knots. I have like this big one right here, like that just goes. I'm gonna post a picture of what I look like when I'm swollen. And it kind of goes like this on the top of my stomach. And the funny part is that's where the seroma was. So that's where they were taking out the fluid every time. And I wore my faja, I was getting massages, I was getting all that, and I still developed fibrosis. So when I asked the massage lady, what should I do to get rid of the fibrosis, she said there's 2 options. 1, you go back to get surgery so they can remove that, or 2, you can do wood therapy massages, and that should be able to take it down after a while. So I have not done that yet. I am planning on going back to wearing my faja. I know it's been over a year, but when I wear my waist trainer, I notice that it does help and it brings it down. So later in the future, when I actually have time, I'm gonna go ahead and get back to that. Let's see. I did get a lot of questions about the stitching. So who removes the stitches? Well, the doctor. When I went back for my post-op, they went ahead and removed the stitches. For my breast, my stomach, I believe they did it too. Yes, they did remove the stitches in my stomach. I think so. Yes, I remember. And the other question is, how is my recovery? The recovery, like I said, it's very intense when you have the surgery. It's the whole, especially if you're like one of those who do everything for yourself. You get up, you take care of your kids, you do all these things for yourself. And then seeing that like you can't get up off of bed on your own because, you know, when you get up off of your bed, you have to use all that stomach muscle and stuff, and it hurts. It's just uncomfortable. So after you have the surgery, you are going to, because I had a lot of women who have reached out to me and said, hey, is it normal to feel like I regret this? And I'm like, yes, it is totally normal. And I'm glad that I'm able to share that with you guys, because honestly, I didn't have nobody to run to. I didn't see, you know, people talk about like the regrets and how they felt after having the surgery. I'm sorry, guys. I get all emotional when I'm like over here trying to like help women and be there for them. So I just had to take a moment. So, but I'm back. But yes, yes, you do have that feeling. I know I did after I had the surgery, where I just regretted it because I wanted to go back to normal. And then sometimes I started thinking, was it even worth it? And then like once you are like fully recovered, you're like, yes, my clothes fit me, this looks nice on me, I like the way I feel, you know, I like the way I look in certain things, and you know, I like the way I step on the scale and I feel better about myself. So it is definitely worth it. In the beginning, the first 3 months is going to be tough. Understand that. It's going to be tough. You are going to be experiencing some pain. You are going to be experiencing some, like, you know, second thoughts about having the surgery. But it's all worth it at the end. It's been over a year for me, and I'm still very happy that I had the surgery. You know, like, I'm able to wear a two-piece and, you know, step out and feel comfortable. Before, I was wearing a whole one piece and I wasn't able to do those things. So I would say don't second guess it. Go ahead and do it. But you know, with beauty, there comes pain. But eventually, it's all worth it. Now, someone has asked me, but there's been people that have asked me, do I have any kind of feeling in my stomach? So I do have a little bit, and then there are some parts of my stomach that is still numb. I want to say like the very top of my stomach, the mid part of my stomach, but like the outer area of my stomach, I can feel that, but I want to say more like in the middle area, like this. I can't really feel much. It's still very much numb. I met a woman who did have a mommy makeover 15 years ago. And I asked her myself, I said, hey, are you numb in certain areas? And she's like, yes, my whole stomach is still numb. So, and I asked her, like, does that make you feel like you should have never had it? And she said, no, she's very much happy that she had it. She loves, you know, her results, and she's happy that she has a flat stomach. So, like I said, ladies, don't let like thinking about what's going to happen after surgery make you regret doing it. Totally get the surgery if it's great for your health, if it's okay for your health. If you have underlying conditions, don't do it. Find another alternative. But overall, I am very happy that I had the surgery, and I am very happy that you ladies have reached out to me, you know, telling me how you feel. I am very much like open. So if there's anything that you guys want to share with me, any pictures you want to share, or just communicate with me about, you know, your surgery, your post-op, how you feel, I am definitely like here. Like I love helping women. But yeah, so definitely, I hope this video helped you guys. If you have any more questions, definitely send me a message. I'll respond, and I will keep you guys posted on a next post-op, or if anything changes. I'm thinking about getting a BBL. I don't know. I don't know yet. I don't know. That's a little scary. I've seen things about it, and I don't know. I don't want to be 65 with a big dunk on the floor. So I don't know yet. I'm still thinking. But yeah, so we shall see. I do want you guys to know that my videos will eventually be transitioning into more like beauty and aesthetic stuff. Like I told you guys before, I have a passion to help women and make women feel beautiful. It's just, I mean, I don't even know where to start, but I did change my career. Like I said before, I was in the medical industry for quite some years, and it was time to leave. So now I'm more into the beauty industry, and I will be transitioning into more like skincare, more into makeup, what I feel is best for, you know, different skin types and all that stuff. So definitely stay tuned, subscribe. There is so much to learn. But yeah, see you guys later.